Hi everybody, this is Dr. Ehsan Sadri, board certified ophthalmologist here in Newport Beach, California. I get asked all the time, what is this red bump on my eyeball or both eyes? And it almost happens every day. In fact, I just saw a patient with one, and it's probably, I would say, 20%, 30% of the visits to the common eye doctor. And while there's a variety of things that can cause a red bump on your eyeball, the major things that are really common in our world is something called pterygium or surfer's eye. That's when you get a little bit of a growth over the eye. It looks like there's something in your eyeball. Typically doesn't affect the vision, although it can cause itchiness. It can sometimes cause redness, especially when we take pictures. Sometimes it's in one eye, sometimes it's in both eyes. The main thing that it can cause cosmetic issues, especially when taking photographs. So what we tell patients is make sure you get an ophthalmic examination, make sure the doctor takes a look at it, and make sure you ask questions about how do I get rid of it and what are the risks. The other things that can cause redness around the eyes can be allergies. Your typical bread and butter allergies can cause a lot of what we call distortion or diffuse, or what we call commonly spread out redness in both eyes. And that's common. Typically though, however, the difference between that is usually in both eyes, almost never in one eye. Number two, how long is it there? Is it there for a few weeks, few months? If it's there for a long time, it's typically allergies. And the last but not least thing that can differentiate that versus bump on your eyeball is the fact that it itches a lot. And so with anti-itchy drops, what we call Patanol or Pataday or over-the-counter anti-allergy drops, you can actually get rid of it. So if you have a history of any allergies in general, that can be in both eyes and usually more spread out redness. But if it's a bump, it's most likely pterygium. And then occasionally patients will come where they wear contacts and they have a bump on their eyeball. And that's due to contact lens wear. It could be a bacterial, it could just be allergy. And typically, if it's a bacteria, it usually hurts. There's a lot of pus or mucus. It's kind of gross. Usually it's on one side, and sometimes it can be serious and affect vision. So rule number one is make sure you get an ophthalmic examination by a local eye doctor. And two, ask questions. Make sure you go through all your different therapies. Hope that helps. As always, if you have any questions, go ahead and send me a direct message, and don't forget to subscribe. Thank you so much.